important and informative HPV module, and I welcome you all for this. Now, January being the Cervical Cancer Awareness Month, I think we couldn't have got a better time to choose this HPV-1 module. And on this occasion, I would like you to share the news that, just a second, I'm sorry. Yeah, so in India, we have at least one woman whom we lose every 5 to 7 minutes of cervical cancer, and something which is so preventable with the HPV vaccination now being available. Of course, I would like to change it, just not a cervical cancer prevention vaccine, but a gender neutral vaccine, because it is known to cause prevention for a host of other cancers in males as well. And I would like to acknowledge the presence of our immediate past president, CIAP, Dr. Upendra Kinjavdekar here today, who has been one of the key persons along with the Cancer Foundation of India, the American Cancer Society, and the FOXI, all the four institutes coming together to devise this module, basically to create an awareness amongst us primary health givers and get sensitized ourselves to the importance of ensuring that each and every young girl child and a boy child in our country gets the HPV vaccine at the proper time to prevent this deadly disease of malignancies later on in life. I would also like to acknowledge here the National Project Coordinator, Dr. Purna Kurkure Madam, and the National Project Convener, Dr. Jitendra Ghawane, who have also been very instrumental in getting this module go across all the various districts and branch in the country. And of course, we have with us today the West Zone Core Trainer, Dr. Amin Kaba, who's also going to be a faculty for this module. So I think before I go on to requesting Dr. Upendra Kinjavdekar to share a few words about this module, requesting all of you to try and keep their videos on and rename yourselves as the whole name with the organization that you're attached with, which is Indian Academy of Pediatrics, and your place of work, so your location. So you can go into your chat boxes, click on the participants link and try to change this. For logistics and for documentation, this is extremely important. So as we go on with the initial welcome, I request all of you to do that. Dr. Upendra Kinjavdekar, sir, a few words from you on this module.
Yeah, thank you so much, Dr. Nehal. Very good afternoon, my dear friends. Respected newly elected president of Mumbai IIP, Dr. Nehal, along with her, the secretary, Dr. Shikha, treasurer, Dr. Amrita, my dear friend, Dr. Amin, and all those who have logged in. It's a great honor to be with all of you for this great initiative that we had started in 2023, the HPV awareness program. And I'm very happy that today morning when I opened the newspaper, that government has planned to initiate 8 crore vaccination of 9 to 14-year-old girls from this year onwards. So every year, I think 2.5 crores, that is what the figure put. I'm very happy that the initiative will be soon started by Government of India. But nevertheless, we pediatricians also need to be very much aware of this fact. Friends, I must again put that though this vaccine was introduced in 2006, we are now in 2024, so almost 18 years are over, but still the percentage of children getting this vaccine being actively promoted by their pediatrician is minuscule. Let me put that word very rightly. So time has come that we all need to be aware that the country like ours, which is a low LMIC countries, low and middle income kind of, we cannot afford the burden of cervical cancer, even the later on screening, early treatment, all that requires a lot of resources. So for our country, anything which is preventive from breastfeeding to early use of ORS, we are all for that. And similarly, HPV vaccine would be one such thing. So this is a great opportunity that all of us will be getting today to get all our doubts cleared from the wonderful faculty. I'm sure this program would go a long way. So this is not only for ourselves, but we are supposed to again train other colleagues of ours, not only pediatricians, but even general practitioners also. So all said and done, I think time has come that we need to really pull our sleeves and work vigorously for the awareness and prevention of HPV. So I'm very happy and best wishes to Mumbai IIP for not only this program, for all your future endeavors. Thank you so much. Thank you.
Thank you so much, sir, for those encouraging words. And I'm sure your sensitizing and your motivational speech is going to, at the end of this module, make all the others who are participating vaccine champions. And I'm sure from now onwards, it's going to be absolutely incorporated into our daily practice that HPV vaccine has to be told, has to be motivated, and has to be really incorporated by all of us. Thank you so much. And over to Dr. Amin Kaba, who's, I think Dr. Jitendra is not there.
You got muted, Nehal. Nehal, you got muted.
So over to Dr. Amin Kaba, who is the core trainer for our West Zone core trainer for the module today and one of the faculties. Sir, a couple of words from you and then we can begin with the module.
It's my honor and privilege to be the West Zone co-trainer for this module. And I really thank Dr. Upendra, Central IIP, Dr. Purna, Dr. Jitendra for having given me this opportunity, and Mumbai IIP, my parent branch, to be a participant and a trainer for this module. I think it's a wonderful module, need of the hour, and for the first time in history that we are stepping forward to prevent a cancer directly. I think it's a fantastic thing that we are embarking upon. Do you want me to start the presentation?
Yes, sir.
Yeah, and just share it. Is the screen visible?
Not as yet.
I think you can, right? You see my screen now?
Yes,
Hello?
we can see your screen.
Yes.
Okay, so I'm starting the presentation. I'll be switching off my video so that the bandwidth doesn't have an issue.
Yes, Dr. Amin, you can start.
Yeah. So this is the pre-training survey. I request everyone who's not yet finished doing this, please do it because this is important for marking your attendance for everybody. It's been put up in the chat as well. It's been put up on the group as well, and you can even scan it directly from your phone, the QR code scanner. It'll take you to the link. So just give a few seconds more for people who have joined late or haven't filled it up yet. The link is there in the chat box. You can always go ahead with it.
Requesting everybody to fill this up. This is going to be for documentation also.
So this is the first disclaimer that the expert review of this original content was coordinated with the Cancer Foundation of India and the American Cancer Society's Global HPV Cancer Free Program. None of the pharma industry were involved in the development of this content, and we do not endorse any company, product, or service. So the overview of the project, we need to sensitize physicians for the cervical cancer burden, the prevention and HPV vaccination. And we plan to support all these members, over 10,000 of them. There will be monthly check-in post-training as well, and a prompt action will be provided to you from the central office. And we request all of you to participate in these prompts as well. This is the entire team that you can see, which is responsible for this starting this module. Familiar faces, Dr. Upendra, Dr. Purna Kurkare, Dr. Vijay Yevle, many other people from Cancer Foundation, from ACS, and from Foxy as well. To begin with, we have a short video by Dr. Upendra Kinzavdekar. He's already addressed the gathering. So can we push ahead for this one?
So is it okay? Is he there?
So friends, I think this is a great day. All of us understand that prophylactic HPV vaccination is extremely powerful strategy, and we want to reduce and not only reduce but eradicate HPV related disease and cervical cancer. We have all understood the efficacy, immunogenicity, safety of this vaccine. And since I think it was introduced in US HPV in
2006, I think it has gone multiple changes as far as the age, years, and what confidence. So why did they make such statement? Is because the nationwide HPV vaccination and simultaneous cervical cancer screening program and their outcome and predictions are extremely promising and exciting for a country like India. So I think organizations like Cancer Institute, American Cancer Society, our own IAP, Foxy, we are all putting forth our educational campaigns, funding, and we have to continue our efforts until at the minimum coverage for HPV vaccine nears that of other our common childhood vaccines. And we are going to all be successful. We are starting on a great note, on a wonderful day, and I'm sure this program is going to be successful. Thank you so much, and let's all continue in our mission till the last individual understands the importance of.
It's Dr. Digant Shastri, IIP past president, who was actually his brainchild that this program
Dear
has
fellow
seen the light of the day.
members, it gives me great pleasure to note that IAP and FOXY, with a combined membership of more than 80,000 physicians, have joined hands to prevent cervical cancer through HPV vaccination. This safe and effective vaccine helps preventing HPV cancers, including cervical cancer. Recommending the HPV vaccine to all adolescents starting at the age of 9 is a part of completing IAP immunization schedule. As pediatricians, it is our responsibility to make sure that every adolescent grows up protected from cancers that can very well be prevented through vaccination. Let us, each one of us, contribute in creating cervical cancer Mukta Bharat. Thank you. Jai Hind, Jai IAP.
These are the national coordinators, Dr. Priya Ganesh Kumar from the Foxy side, and Kurkure Madam, who's the head of Oncology Committee of IIP and the national coordinator of the HPV project. Has ma'am joined? Dr. Nehal?
No, she isn't there. She isn't there.
There's a short message from her as well.
I am Dr. Purna Kurkure, National Coordinator of IAP Foxy HPV vaccination project under the aegis of American Cancer Society in association with Fox Cancer Foundation of India. I welcome you all to this momentous occasion of creating warriors against HPV related cancers across the country in India. We are trying to have this master trainers program, and each master trainer will subsequently train 100 member pediatricians across the 5 zones, and thus we are going to have almost 10,000 plus pediatricians who are equipped to communicate to the parents about importance of HPV vaccination and motivate them to vaccinate their girls to prevent cervical cancer. And I expect all of you to cooperate and take this moment forward to create a cervical cancer Mukt Bharat. Thank you, and we let us all work together for this.
These are the trainers for today. I'm Dr. Amin Kaba. I'm the core trainer for the West Zone, and we have Dr. Nehal Shah, who's the master trainer for the West Zone. She's also the new president of Mumbai IIP now. So the agenda for this meeting, there's an evaluation pre-survey. I believe everyone has filled up the survey. If you haven't, the link has been posted in the group. It's there on the chat box as well. Right in the beginning, you can just scroll back the chat and go through it. The first module will be about cervical cancer and the HPV vaccine. And the second module will be communication strategies, which is something that we've never been taught even in our PG days. So I think it's probably the more important one because science, we know everybody has read that. So just basic pointers, everyone needs to keep their camera on and you can participate using the chat, the question answer feature. I suggest everyone to rename yourself on Zoom so that it's easier for us to take your attendance, your name, your organization. It's quite easy. I think all of us are conversant with this. You go to the participant list and more on your name, video tell, and then you can update your name. Begin with the first module. So this figure, just keep this in mind. 77,348 women die every year in India from cervical cancer. That's one woman every 5 minutes. Do you want to hear the story of a cancer survivor or we can go ahead with the science part?
I think we can go ahead with the science so we get little time for communication.
So this is just a video about one of the cancer survivors who was talking about how it hit her during her peak life. So the World Health Organization has planned to achieve elimination of cervical cancer, and we have a three-pronged attack. So in which we need to do 90% vaccination of children by the age of 15 years, 70% screening at the age of 35 and 45 for women, and 90% of the women who have been identified with cervical disease should receive treatment for precancerous lesions or invasive cervical cancer. This is the global strategy for elimination of cervical cancer. And how do we come towards this goal? So it's as Dr. Upendra said, we are planning to get it included in the universal immunization program. Our first HPV vaccine has already been launched, which has been really taken up very well. The Ministry of Health and Family Welfare is planning the campaign, and we are one of the part of this jigsaw puzzle where a strong physician recommendation really helps in getting things on track. So why should you recommend cervical cancer vaccine, HPV vaccination? I'm sorry, this is a gender neutral vaccine. Please remember that. So physicians are the most trusted source of HPV vaccination information for parents. And increasing this vaccine coverage in girls will avert more deaths per person than any other immunization activity. Remember, we are directly preventing a cancer. And over 80% of the cervical cancers can be prevented through HPV vaccination. And together, we can really eliminate cervical cancer in India. So how much is the burden? This figure is from 2020. You can see that 604,000 cases worldwide, of which 90% are from lower and middle income countries, and 342,000 cases, 342,000 deaths, of which, as you said, we said 77,000, almost 1/4 of the deaths from India. He said that 90% in low and middle income countries are from these from lower and middle income countries, and more women die of cervical cancer now than from childbirth. This is a pictorial showing the map. The darker the color, the more the prevalence and the mortality rates because of cervical cancer. You can see India is a deep red. We are not as bad as Africa, but I think where we are right now, we shouldn't be even in that color now. So what is the burden of cervical cancers in India? We have 124,000 new cases every year and 77,000 deaths. And new cases will increase by 54% in the next 20 years if we don't take action now. And the ripple effect, because this cancer hits the woman when she is in her prime. So your caretakers, the mothers, the income earners, the workforce is hampered, leaders are hampered, even the teachers. This is a statement from, I believe everybody knows this gentleman. He's Dr. Tedros, who's the WHO Director General. And he says that cervical cancer strikes women in the prime of their lives who are raising children, caring for their families, and contributing to the social and economic fabric of the communities. And not acting right now will cause an increase in cervical cancer deaths, and we can prevent this. Let's talk a bit about the vaccine, about the virus. More than 150 types identified, and of which 14 types of HPV can cause 6 types of cancers in men and women. Cancer of the cervix, vulva, vagina, penis, anus, and even the oropharynx. Remember, the virus infects both men and women alike. An estimated 50 to 80% will get at least one type of HPV infection in their lifetime. Most of the HPV infections will be asymptomatic, and the body fights it off most of the times in about 2 years' time. But everyone is not so lucky. And if the HPV doesn't go away on its own, it causes changes in the healthy cells as well. Remember, it's spread from skin to skin contact. During sexual contact, it can be passed just through a single exposure itself. So it's not that condoms will prevent the HPV transmission every time, and it can spread even if someone has delayed sex until marriage. And remember, a penetrative intercourse is not required for exposure. And we know that the HPV vaccination is the most effective method for primary prevention. So what happens? You can see the normal cells on the left, how an HPV infection has entered in, slowly goes on to precancerous cells and then cancerous cells. The last line is most important. Persistent infection for 5 to 20 years gives that much time, such a long incubation period, just goes on and on, smoldering and then gradually damaging the cells and landing up in cancer. So which HPV infections can become cancerous? So if it's a high risk HPV type, we'll come to the numbers shortly, or it is persistent, that is, the infections do not clear over time. In India, 84% of the cervical cancers are caused by 16 and 18, and the persistent HPV infection causes cervical cancer. Good hygiene is important for everybody, and vaccination is the best way to prevent infections and cervical cancer. So what do we do? First point, that's where we come in, 9 to 14 years old. These children come to us. So HPV vaccination at that time. Screening of the women at 30 years, that's where our gynecologists come in. Even we come in because these mothers come to us with their kids, which goes on till 65 years of age. We'll come to the recommendations also later on. And this is the team, gynecologists and pediatricians coming along with CFI and ACS for this wonderful project. What about the vaccine? It's a recombinant L1 capsid protein that forms virus-like particles, which are non-infectious and non-oncogenic, and they produce much higher levels of neutralizing antibody than a natural infection. The vaccines which are available, bivalent GSK, which is for females only, which has been withdrawn now. Quadrivalent, two of them are there. One is the Indian by Serum Institute of India, which is Servavac, and quadrivalent the MSD vaccine. Both of them have the strains protect against 16, 18, 6, and 11. And the nonavalent, 9-valent, which is against the 9 different strains. So these are the types that cause cancers. And now the types which are included. So 16 and 18, as you can see, the blue color in the center, 84% of the cervix cancers are caused in India by these two. The 6 and 11 cause 90% of the genital warts. So someone who's taking the quadrivalent vaccine protects themselves from about 90% of warts and 84% of cancers. And to protect themselves against 15% of the cancers, they need to take the nonavalent if at all they can afford it. Remember, these 4 lines will come again and again, and they need to be like your breathing. HPV vaccine is effective. HPV vaccine is safe. It starts at the age of 9, and your recommendation is most important. Let's talk about the vaccination. You can see this is a study from Sweden, and the key findings are shown in the left, right at the bottom, where 538 cases were seen in unvaccinated and only 19 cases in vaccinated, and 2 cases in 10 to 16 and 17 cases 90,000 who are beyond 17 to 30. So as you can see, the cases were more when they were vaccinated much later on in life. And 88% protection against invasive cervical cancer when you're vaccinated before the age of 17. This is another trial from India. You can see that the number of CIAP carcinoma in situ were only 5, and the vaccinated had no incidences of cancer. HPV vaccination is safe. There were more than 160 studies in so many countries all over the world, more than 175 million doses administered, and all the concerns about any kind of major reactions and autoimmune and all have been put to rest. The commonest ones are just your little pain at the side, some pain, some fever, some fainting and all was there, but that's been known in adolescents because it's been, they have that little high vagal tone and so many of them do collapse which can happen with any vaccine. So no greater risk of anaphylaxis or GBS or any kind of blood clots or appendicitis. This is every year wherein they have proved everything. So no autoimmune disorders, no thromboembolism, no multiple sclerosis or other demyelinating diseases, or any kind of ovarian insufficiency or rheumatologic conditions. Protects and does not harm the fertility. Many people come to us saying that it's a conspiracy by the government to kill the fertility of women. Nothing of that sort. It in fact protects the future fertility by preventing the problems linked to cervical cancer and its treatment as well. And it's a safe way to protect the health and ability of our women and to have healthy babies. Remember, the vaccination starts at the age of 9 years. So when you give it on time, between 9 to 14 years, only 2 doses are needed, so it becomes economical as well. When you give it after the age of 14, that is 15 to 26, you need 3 doses. Remember, if it's an immunocompromised patient, then the 3 doses are required anytime. Vaccinated girls should also follow the cervical screening guidelines into adulthood. See this is very important. So when the child has been vaccinated between the age of 12, 13, the effectiveness against CIN3 plus was 97% and 87% against cervical cancer. Whereas just reaching 14 to 16, the effectivity has gone down to 62% and beyond 16 to 18 as low as 34%. But whatever it is still going to protect. So we need to do that. Also, the advantage, it gives you more time to complete the dose when you start early before the age of 15. It results in a much stronger immune response. We ourselves very well know hepatitis B is the commonest, that adults don't react so well to the vaccine as compared to children. And there is an increased likelihood of exposure to HPV if the child has not been vaccinated earlier in life. Also, it prevents the sexual activity questions by parents and all that come to us that my child is not going to have sex till much later on in life. So that also is averted. Increased vaccinations and therefore cancers are prevented. And this is highly acceptable because as children, the parents are primed that the vaccinations have to be done. It's much easier to vaccinate kids. Science is very clear, as I said so many times, that the path to cervical cancer and elimination is possible. So again, the elimination strategy, 90% of the girls vaccinated by the age of 15, 70% of women screened using a high performance test by the age of 35 and again by the age of 45. This is the bare minimum screening that we are talking about. And the 90% of women who have been picked up for pre-cancer should be treated rightly at the right time. And the median cervical cancer incidence rate will fall by 42% and by 97% in the next century. And we will have averted more than 74 million new cases of cervical cancer. Again, a statement from Dr. Tedros. It's a historic moment for global health. I congratulate all of you to be that who are a part of this wonderful project. And this is the first time that the world is committed to eliminating a cancer. There is a short video, it's almost 5 minutes, which actually continues with almost the repetition of what I said, but the main slide is right there in the screening because there was a demand from pediatricians that we need to know about what to do for women as well. So the recommendations are available on the Foxy website as well, and these resource materials will be given to you. A quick go through this slide, when to start screening. So at the age of 25 years, when it's a good resource setting, and universal recommendation is at 30 years. When to end screening at the age of 35 years, when 3 consecutive negative cytology results are there, or 2 consecutive negative HPV tests within 10 years, and the last one should have been within 5 years. The screening interval, as we said, at least twice in a lifetime at the age of 35 and 45. Remember, this cancer smolders on for a very long time, 5 to 20 years. So that's why when I'm talking about a limited resource setting at the age of 35 and 45, 10 years apart, or otherwise a cytology every 3 years or VIA every 3 to 5 years. After a hysterectomy, it's not recommended if the hysterectomy was done for cancer or if the cervix has been removed. However, if the hysterectomy was done for a cancer or a pre-cancer, then the screening needs to be continued. For immunocompromise, again, we need to be a little more vigilant, and you start at 25 and screen more frequently. I think that does for the vaccination part. Do you want to do the questions now, or do we do it later with the communication strategies later on?
So I think there is only one question by Dr. Meghna, and she has asked whether this vaccine should be recommended to a 30-year-old, number one, and thereafter, what about the idea of vaccinating 50 and 60 years old? So I
No,
think
no.
you can
So
answer
yeah.
that, Dr. Amin. We've already covered that.
So that's 50 to 60 years is not there. We talked about that the vaccination recommendation for the older one, the Gardasil 4 is 9 to 45 for females, so 50 to 60 years doesn't come in. And when you're talking about vaccinating a 30-year-old lady, it has to be on a one-to-one conversation. Ideally, an adult physician or a gynecologist should be doing the vaccine with every kind of care that you need. Basic resuscitation measures should be available for all vaccinations, and she should know that the uptake is not that great. The recommendation that is there for the nonavalent is 9 to 14 years for male and 9 to 26 years for female. And the Cervavac, which is the which is the Serum Institute vaccine, it is 9 to 26 years for both male and female.
So your quadrivalent
This is
MSD, which is your
yeah.
Gardasil 4, is recommended actually for all females in between 9 and 45. But as it is emphasized in module 1 that the best time to vaccinate girls is in between 9 and 16. Only then we are going to prevent almost 87 to 90% of the cervical cancers and CIN stage 3s. The later you go, the incidence of protection is going to go down. So this has to be discussed on a 1:1 when the young mother also asks for a vaccine with the daughter. And if they're okay, then of course there are no major side effects. For whatever purpose, they can be still vaccinated. So then with this, we can move on to module 2, which is all regarding the strategies to effectively communicate with the parents regarding this vaccine. So we are going to cover the parent beliefs, what they feel about the vaccine, how we as health givers are going to make a very strong recommendation to begin with, and answering the common questions that come off from the parents. So
There's
this
again
is,
a short
yeah.
video from Dr. Somas Aminathan. Do you want that?
No, I think we can skip this video because it's all about just promoting cervical cancer vaccine. The second video, if at all, we'll run that. So what are the parent beliefs about this vaccine? The research questions regarding this formation of the module were all around how do decision makers interact with the healthcare system? What knowledge do they have about the HPV vaccine? What are the beliefs of the vaccine? What are the challenges that the physicians and the caretakers face while discussing this vaccine with the decision makers? What are the key factors that affect the decision making around the HPV vaccine? And what are the general beliefs and vaccinations? So we will cover this module 2 under these factors. Let's begin with what are the parents' beliefs about health and vaccination. So overall, we all know that any parent feels that they want their children to be healthy in future and of course free from all diseases. They believe that vaccines keep the children healthy and they definitely prevent diseases. And they also consider that vaccines are safe and beneficial. This is the overall, as far as any vaccine and health is concerned, as far as a parent understands. Now, what is a parent's awareness of cervical cancer and HPV vaccination? So, the research data suggests that most of the parents are largely unaware of cervical health, screening, and cervical cancer. HPV vaccine, its benefits, and its link to preventive cancer are also quite unknown to most of the people. They would also not know how HPV spreads. And so, the question comes next, Dr. Amin. Your recommendation really matters. They always feel like how a mother from a Calcutta, when was interviewed for this, said that the position of the doctor is after God. Only doctors can cure us. They are very caring and they answer all our questions. This is the general notion that they have about us. Similarly, a father from Howrah said the same thing, that they trust the doctor completely and whatever information comes from the doctor regarding the health of the child matters to them. So the opinion of a health giver is very important. And again, coming back, that our recommendation would really matter in this. Parents consider healthcare providers the most credible source of information on HPV vaccination. And so again, we would make a strong recommendation to take this vaccine. Make a clear recommendation. So number one, note the child's age when he's coming to your OPD. Tell the parent that girls this age are due for a vaccine that can actually prevent cervical cancer, and then recommend that they should vaccinate this child. So how would it go like? Preeti is a 9-year-old, which means she needs her first dose of HPV vaccine, which protects her from cervical cancer and other human papilloma virus related cancers. And cervical cancer is a very common cancer in India. So we do recommend that she should get this HPV vaccine. Moving from making a recommendation, next, we connect to the patient. So sometimes the parent will come back to you when you make this statement and say, does she really need it so young? So you need to reinstate that. So you are wondering why she needs it at this age. The importance of restating the same thing is that develop a confidence and connect to the person that you're actually listening and you're worried about what she feels about it, and then share the knowledge. It's best to vaccinate when they are younger because we will prevent the most HPV cancers at that age. And this is an HPV cancer preventing vaccine. So we strongly recommend that your child should take it at the appropriate age. Share this with your patient. Now, one tip regarding, talk about the HPV vaccination as a cancer preventing vaccine. The most important genesis of this entire module and the policy that has been taken up, the drive that has been taken up, obviously is looking at a cervical cancer mukt Bharat in couple of decades from now, because it is completely preventable and because it is taking the life of a woman every 5 to 7 minutes. So when you tell them that the HPV vaccination is actually a cancer preventing vaccine, it registers with them more and relates to them in giving this vaccine. Follow up with the parents who had initially refused to take the vaccine. The next tip. So if a parent declines at the first visit, you should not give up. At the next subsequent visit, you can probably take this topic again and tell them. So how do we start the practice about this? So this is a sample recommendation that she's a 9-year-old, which means she's due for a HPV, which protects against cervical cancer and other cancers. And I strongly recommend she should get it. Let's book an appointment for your cervical cancer screening. And is your daughter about 9 now? Now this, you're looking at the other way. Suppose it's a young mother, you can tell them that you can book an appointment for a cervical cancer. She's already 30 years old, due for a first screening. And then, is your daughter also 9 years old? I recommend that she should take a HPV vaccine to protect her from a cervical cancer. Next. So let's practice how we will become very confident as caretakers in putting across a strong recommendation. So at this stage, I will request one or two of you to quickly put a sample recommendation. You can just please unmute yourself and read it out, maybe in a vernacular language, how you would get across to your patient's parent and convinced for the need. So any one of you, I think, unmute yourself and you can just say how you would put a recommendation. Any one of you? Dr. Rajesh Kasla? Dr. Rajesh, you want to say? Dr. Kamlakar, Meghna, Dr. Megha, you want to say? Okay. Okay, so let's go ahead. Yeah, somebody wants to volunteer?
Yeah, Dr. Kamlakar, I think, is volunteering.
Yes, sir. Yes, sir.
So you want me to speak in Marathi?
Yes, yes,
Yes,
please.
that would be great.
Please.
या आता तुमची मुलगी किती वर्षाची आहे? बहुतेक 9 वर्षाची आहे. 9 वर्ष ते 14 वर्षामध्ये जर तुम्ही तिला HPV वॅक्सिन जे आलेलं आहे, जे सर्वायकल कॅन्सर प्रिव्हेंट करतं, ते दिलं तर तिच्या आयुष्याची तिला खूप मदत होणार आहे तिच्या आयुष्यात, कारण की ते खूप इफेक्टिव्ह वॅक्सिन आहे. 84% वरती लोकांना ते सर्वायकल कॅन्सर प्रिव्हेंट करतं आणि त्यामुळे बऱ्याच डेथ्स आपण प्रिव्हेंट करू शकतो. आणि हे वय अतिशय अप्रोप्रिएट आहे, कारण की तिची इम्युनिटी किंवा तिला प्रतिकारशक्ती खूप होणार आहे त्याने. तर तुम्ही आता लवकर डिसिजन घेऊन लवकरात लवकर तिला पहिला डोस देऊन घ्या, मग आपण पुढचं शेड्यूल ठरवू.
Very good, excellent.
Beautiful.
Thank you so much, Dr. Kamlakar. Very nice. So he has made a very, very strong and a clear recommendation going through all the points that we said. Put it across, share and connect with the patient. Let's go to answering the parents' questions. So these are like the common FAQs that will come from the parents. Parents want information about how to keep their children healthy and cancer-free, the vaccine benefits and the costs, and the side effects. The common question would come as that I lack information about the HPV vaccine as far as the cause, the types, and the schedule is concerned. Could you highlight me? And then it will come. You can go on to the safety and the side effects. If a parent asks questions or, okay, come next. Okay. So the question most commonly that comes from most of the parents is, are HPV vaccines safe? So here we need to emphasize that yes, they are completely safe like any other vaccine. Millions of children have received safe HPV vaccines over 100 countries worldwide. And they are the most studied vaccinations on the market, and studies have shown that they are very, very, very safe, free from major side effects. The second common question would be, does the HPV vaccine cause any other minor side effects? So again, like any other vaccine, a local redness, a local swelling, a local discomfort at the site of injection is common, which can be overcome by giving them simple paracetamol. Very rarely a child can have an allergic reaction to the injection. And like any other injections, the child needs to be observed for at least 10 to 15 minutes to prevent a possibility of fainting. Will HPV vaccination harm my daughter's fertility? This is a very common question that comes from the mothers. And then again, the answer is that no, it does not harm the fertility. In fact, it prevents infertility by treating and preventing most of the precancerous and cervical cancers. So some mother may say that a friend's daughter had a reaction to the vaccine. So should I be worried? So you can tell them that, yes, I can see how this might worry you. But again, emphasizing that it is a very safe and some minor side effects are known. And over that side effects, you also need to know that it is very sad to see a woman diagnosed and dying of cervical cancer every 5 minutes in India. Second most common cause of cancer in women in India, which is completely preventable. So I think you should go ahead barring the minor side effects. So practice answering the safety questions. We can take this later on with the general role play.
Age questions.
Yeah. So now age related. So most of them would tell you that why do we need it at this particular age? So you can tell them that most vaccines are given at younger ages to prevent diseases from coming up in future. And of course, HPV vaccine works best in between 9 and 14 years before there is any chance of HPV exposure. Research shows that on-time vaccination provides more protection from HPV cancers than later vaccination at older ages. So is my child really at a risk for HPV infection? So you need to tell them that yes, HPV infection is very common. At least 50 to 80% of us are exposed to HPV infection at some point in time, but over 2 years we try to get out of it. Few unfortunate ones may go on over a couple of decades to develop precancerous and then cervical cancer lesions. So on-time vaccination is extremely important. Can she not get the vaccine after marriage? Most of them would say she's too young. Why does she need it now? She's not even exposed to any kind of penetrative sex. So again, you need to emphasize that yes, it has to be given before 15th birthday because you want her to get the maximum protection against cervical cancer. How long will the protection from HPV vaccine last? This is a common question. So again, the HPV vaccine provides a long-lasting protection, and there is enough evidence and studies to show that the immunity given by this vaccine lasts well into adulthood. There is no indication that the vaccine protection wanes with time. So at the moment, no boosters are needed. So again, this we'll take up later on. We can take a common role play. Very, very important. Can boys get the HPV vaccine? Yes, the HPV vaccine can be given to both boys and girls because it's a gender neutral vaccines, and both of them are more prone to different kind of cancers as they grow up. So what is the cost of this vaccine? That there are 3 types of vaccines available in the market. We have our own indigenous Sarvavac, which is of the tune of 2000. And as Dr. Amin has pointed out, and we all need to remember that from 9 to 26 years in both males and females, you can give this. Then we have the MSD Gardasil 4, which is about 3,900, 4,000 rupees, and which can be given to women from 9 to 45 years of age. And of course, the latest Nonavalent Gardasil 9 by MSD, which covers all the 9 strains, which is to the tune of 10,800 to 11,000 rupees. And it's given in between 9 and 14 years for boys and 9 and 26 years for girls. So why does my child need HPV vaccination? As we said, it is not just cervical cancer, but also vulval, vaginal, anal cancer, and oropharyngeal cancers. So on-time vaccination will protect her from all this. What cancers are caused by HPV? As we said, in women, vaginal, vulvar, cervical, anal, and oropharyngeal and throat. And in boys, in addition to that, oral, throat, and anal, we have the penile cancers. Does HPV vaccination work? So of course, we have seen it through and through that it is proven that it is extremely effective for preventing genital HPV related warts as well as different kind of pre-cancer invasive neoplasias and cervical cancers. So they will say, would you give the HPV vaccine to your children? It is a common question that whenever it comes to treatment, diagnosis, investigations, and again administration, they would always say, Doctor, aap kya karoge? Will you give it to your children? So you need to emphasize that yes, my children or the older ones, my grandchildren have got the HPV vaccine because it is considered extremely safe and very effective. Or if I would have had children or grandchildren, then I'm definitely going to give them and protect them from these HPV cancers in future. The second common question is, should there be a gap in between HPV vaccination and other preteen and teen vaccines? So this is a very important tip that you don't want to lose out on these patients. Like we see that most of our practice is preventive and usually rotating around immunizations. You may see a person coming right at 10 years for the second booster or a Tdap. You can probably couple this with that visit and it can be safely administered with the Tdap, TD, your annual flu, or even the COVID-19 vaccine. Many children who are traveling abroad universities, they are strongly recommended meningococcal vaccines, and even this can be given safely with our HPV vaccine. So now what is the summary of this entire module? What we knew today from the module, that HPV is very common. HPV causes 6 types of cancers. The HPV vaccine is a gender neutral, very safe and effective vaccine. And currently there are not enough kids being protected and we need to take this forward. So key messages to share with all the parents: HPV vaccination is cervical cancer prevention. Here it is mentioned cervical cancer because still we haven't got a go ahead and licensed for males, which will soon be done. And of course, the bivalent HPV vaccine is already rolled out by the government in about 6 states in India. And we are very lucky to have it in our state also post elections, maybe by the mid of the year, where two shots will be given to all the children of the bivalent variety, which is the 2 strains which are going to prevent cervical cancer. The HPV vaccine is safe. HPV vaccine provides long-lasting protection and it works best when given in between 9 and 14 years of age. So this next, Dr. Amin. So call to action. After this module, let us all be HPV vaccination champions. Request all of you not to exit from this group because we will be reviewing all the resources and the materials and share it with you on the group from time to time. Monthly updates will be given and actions will be taken. So for you also to carry this forward. Recommend HPV to all your 9 and 14 years old who come to you. So immediate next steps after today's module would be select, print and display your in-clinic poster, which will be shared with you on the group. And share "Don't wait to vaccinate" flyer with your patients. Most of you must be aware that a lot of WhatsApp videos regarding this is already in circulation by brand ambassadors like Shilpa Shetty and the Miss Teen India. So I think we can share that with our parents that it's a very strongly endorsed vaccine, which is quite important. So any questions from, okay, so if any young woman at 28 years wants to take the Gardasil 9, what should we recommend? What age was it put up? Sorry.
So the licensing, as we said, from DCGI is only from 9 to 26 as of now. It's one-on-one conversation with them that the protection will be lesser, and though it's an off-label shot that you would be giving.
So Dr. Nilesh has asked that if a child takes the first HPV shot at 10 years and comes after 5 years at 15, what dose schedule should we follow?
So one more dose because the priming has already been done.
Yes.
36-year-old with
Already
HPV positive. So even HPV positive people can take the vaccine. But remember, as we said, the current DCGI approval is till 26. However, the quadrivalent Gardasil 4 is available till 45. But you need to tell them that it may not protect you from that really great protection
The
that we are talking about,
immunoprotection may not be
80%.
as effective. It may go down
Yeah,
to less
but
than
they can take it.
60%.
Yeah.
You don't know what serotype is she infected with. So anyways, she could get protection from the other serotypes as well.
We need to fill up
what
this
is-
post survey as well.
Yeah. One more. If the child has taken HPV 4, should we counsel for HPV 9? I think we should make them aware. We should at least tell them regarding that. And then if they want, they can probably take the HPV 9. I have a 17-year-old guy with UTI admitted in my ward. What HPV advice can I give her? HPV vaccine, madam, you mean? Dr. Harvinder? Oh, Dr. Purna Kurkure, madam, has joined.
Yes,
Welcome, madam.
yeah.
Good afternoon, madam. So nice to see you. So she is the national project coordinator, and of course, the main executive lead in this program. So, madam, we did run your video, and it's very nice to have you here today in the module.
Oh, there are two places where this is being run. So
Right.
I just switched from one to another.
Thank you so much, madam, for
Ghaziabad
joining.
and you people, you are doing simultaneously. Yeah.
Right, madam.
Good, nice attendance. Nehal, you have been, Nehal, Dr. Amin, you have been doing a very good job.
Thank you so
Please
much, madam.
carry on, carry on.
Sure, madam, sure. So requesting everybody to take up this post-module survey. Again, as we said,
I only want to say one thing, Nehal,
yes, madam.
that we are in a process of making this posters in the local languages, and soon we will be sharing that. American Cancer Society has taken that job because you have to have a back and forth translation to be scientifically correct.
Right,
so
madam.
once they send and share this link, we will share, and you will have an access to Marathi versions of Hindi, Marathi,
Local
English
languages.
is already there.
Right.
Local languages, regional.
Yeah, right.
At
That
least
would be
6
really great,
languages
madam.
we have taken up. 6 common languages.
Sure, madam.
Bengali, Gujarati, Marathi, Hindi, and some more. I don't remember, but regional
Right,
languages,
madam.
it will be translated and circulated. So please remain on the group, and your time starts now. I would say that you have to carry on with this mission and spread the word in the society about wherever you are, to your colleagues, to your doctors, vaccinators, healthcare workers, everywhere. So this is just the beginning of the whole journey. Thank you.
Thank you so much, madam. Thank you. So yes, we have to get sensitized ourselves and make our patients also sensitized and aware and take this forward as a very, very important and path-breaking campaign globally. Okay, so I think everybody must have done the post module survey. I think we can go on to one communication scenario, Dr. Amin.
Yeah, I think so. We should.
So we will require a pair of volunteers. We will have one of you who will be playing the role of a health giver, and one of you who will be a parent. So you can take up these the entire questions related to this module in a communication scenario. How would you recommend? How would you share? How would you connect? How would you emphasize? And how would you finally make them agree to take the HPV vaccine? In a small communication scenario, maybe in a again in some non-English language, vernacular language. So I think any two of you who can quickly volunteer, and requesting everybody, if you can just switch on your videos for the last 5 minutes of this module, it'll be a nice interaction for all of us. And two of you can quickly volunteer for this.
Yeah.
So again, for documentation purposes also, today's this thing is very important. So I'm sure all of you have changed your name as requested earlier. And if you can all switch on your videos, it will be great. Dr. Neeta, you want to volunteer as one of? Okay, Dr. Rajesh.
Yeah, I will volunteer because my last time when you told me there's some problem with audio, I couldn't.
Okay, you want to become the doctor, or you want to become the
No,
parent?
I'll become the patient, the mother.
Patient. So who is going to be the doctor? Dr. Mayur Chheda. Yes, sir. Dr. Mayur, you can probably unmute yourself and switch on your video. I think he pointed out. No. Who else is volunteering with Dr. Rajesh Kasla? Dr. Kamlakar did a wonderful job, but I thought if somebody else is ready to volunteer. Dr. Neeta, you can volunteer as a doctor.
Yeah, Neeta,
Dr.
fine.
Arpit. Dr. Arpita wants to do it? No, I think she's into something. Okay, Amruta, come. You become the doctor.
Okay, I did it last time. Somebody else wants to.
No,
Anuja
it's-
is there. Dr. Anuja is also counsels very well. Anuja, you
No,
want
no.
to do it?
Where is she?
I'm okay. Hi. I'm
Yeah,
here.
great.
Yes.
Come in,
Hi,
Dr.
Anu.
Anuja. So you are going to be Dr. Anuja today for a
Yes,
parent
yes.
who is your patient and who has come in. Yes, Dr.
Yeah.
Rajesh.
Hi, Rajesh sir.
Hello.
So, yeah, अभी हिंदी में करेंगे?
Yes,
हिंदी में करेंगे,
that
कोई
will be
बात
good.
हाँ, ठीक है. ओके. हेलो राजेश जी, आपकी बेटी 9 इयर्स की है और आप रूटीन चेकअप के लिए आए हैं अभी. पर 9 इयर्स के बाद हमारे यहाँ पे एक बहुत ही इम्पोर्टेंट वैक्सीनेशन है जो कि ह्यूमन पैपिलोमा वायरस के अगेंस्ट है, जिसको हम एचपीवी वायरस बोलते हैं. और ये वायरस बच्चों में हम वैक्सीन इसीलिए रिकमेंड करते हैं क्योंकि बड़े एज में सर्विक्स जो होता है, यूटरस का जो मुंह होता है उसे सर्विक्स बोलते हैं, और उसका कैंसर ये वायरस क्रिएट कर रहा है, और ये सेकेंड लार्जेस्ट कैंसर है हमारे इंडियन विमेन में. इसीलिए ये बहुत ही जरूरी वैक्सीन है. और जितना यंग एज होता है उतना ये वैक्सीन का एफिकेसी बढ़ जाता है. तो 9 से 14 इयर्स, 9 से 14 साल के बीच में हमें 2 डोज देने पड़ते हैं 6 मंथ्स की गैप से. और आपकी बेटी ऑलरेडी 9 इयर्स की है, तो आप कंसिडर करिए ये वैक्सीन, और ये बहुत ही जरूरी है. ये 84% वैक्सीन कैंसर्स प्रिवेंट करता है, और ये बॉयज में भी जरूरी है क्योंकि मेन में, बड़े अडल्ट मेल्स में ये जेनाइटल वॉर्ड्स, जेनाइटल स्किन के अराउंड जो भी वायरस रिलेटेड स्किन के कंडीशंस होते हैं वो भी प्रिवेंट करता है, और एनल पीनाइल कैंसर्स भी प्रिवेंट करता है. थ्रोट और ओरल कैंसर्स भी ये वायरस की वजह से होते हैं. तो ये वायरस के अगेंस्ट जब इम्यूनिटी बनी रहती है तभी ये सारे कैंसर्स हमारे प्रिवेंट हो सकते हैं. इसीलिए आपके बेटी के लिए बहुत ही जरूरी है. आप प्लीज ये कंसिडर करिए, और आपका हम अपॉइंटमेंट शेड्यूल कर लेते हैं. कोई
मैडम,
क्वेश्चंस
लेकिन
है आपको?
या मेरा ये क्वेश्चन है कि ये कैंसर के बारे में इतने छोटे बच्चों में तो मैंने कभी सुना नहीं है किसी को सर्वाइकल कैंसर होता है. तो
नहीं
आप
सर, ये छोटे एज में नहीं होता है. कैंसर होता है बड़ी उम्र में, 35 उम्र के बाद, 40s के बाद. पर ये जो वायरस है ये सेक्सुअल इंटरकोर्स के दौरान ट्रांसमिट हो जाता है, और काफी लोगों में ये वायरस का इन्फेक्शन होता है. ये वायरस का इन्फेक्शन एसिम्टोमेटिक है, यानी इसमें कोई सिम्टम्स नहीं होते, और इसको बॉडी अपने आप फाइट कर देती है. पर अगर रिपीटेड कैंसर इन्फेक्शन, रिपीटेड एचपीवी वायरस का इन्फेक्शन हो, तो वो कैंसर के चेंजेस का एक शुरुआत हो सकता है, जो आगे 15-20 साल में कैंसर हो सकता है. तो छोटे बच्चों में जो कि सेक्सुअल एक्सपोजर भी नहीं है, फिर भी हम ये रिकमेंड करते हैं क्योंकि यंगर एज में इम्यूनिटी बहुत अच्छे से पैदा होती है बॉडी में. तो ये जरूरी है, यंगर द एज बेटर द वैक्सीन अपटेक.
मैडम, दूसरा क्वेश्चन ये है कि इतने सारे वैक्सीन है तो हमको कभी लगता है कि इतने सारे वैक्सीन देने से हम लोग उसका इम्यूनिटी और डिस्टर्ब तो नहीं कर रहे हैं.
नहीं, इम्यूनिटी डिस्टर्ब नहीं होगा क्योंकि ये जो वैक्सीन है ये ह्यूमन पैपिलोमा वायरस के काफी सबटाइप्स होते हैं, जो वो सबटाइप्स का नॉन इन्फेक्शियस वर्जन ये वैक्सीन में है, जो हमारे बॉडी के इम्यूनिटी को सिर्फ ये वायरस का एक्सपीरियंस करवाएगा. बॉडी बहुत अच्छे से एंटीबॉडीज बना के रखती है, और अगर जब भी फ्यूचर में ये वायरस अगर कांटेक्ट में आया बिकॉज ऑफ सेक्सुअल इंटरकोर्स और व्हाटएवर अदर रीजंस, तो बॉडी इसको इमीडिएटली फाइट ऑफ करेगी, इन्फेक्शन होने नहीं देगी. तो फर्स्ट प्लेस में इन्फेक्शन नहीं होगा, तो फिर आगे जाके कैंसरस चेंजेस भी नहीं होंगे.
मैडम, इसके कोई साइड इफेक्ट्स है?
नहीं, इसके लॉन्ग स्टैंडिंग कोई भी साइड इफेक्ट्स नहीं है, तो आपको डरने की बिल्कुल जरूरत नहीं है. हर एक वैक्सीन का इमीडिएट थोड़े बहुत साइड इफेक्ट हो सकते हैं, जैसे कि लोकल जहाँ पे हम इंजेक्शन देते हैं वहां पे थोड़ा रेडनेस हो सकता है, या थोड़ा फीवरिश लग सकता है. थोड़ा माइल्ड पेन हो सकता है, पर ये हर एक वैक्सीन के साथ हो सकता है और ये भी हर बच्चे के साथ होगा ये जरूरी नहीं है। पर ये वैक्सीन का जो एडवांटेज है, ये जो हम प्रिवेंट करने वाले हैं आगे जाके, ये बहुत ही जरूरी है। तो ये 2-3 दिन का जो भी माइनर साइड इफेक्ट का पॉसिबिलिटी है, उसके लिए आई विल गाइड यू कि क्या प्रिकॉशंस लेने हैं।
मैडम आप बुरा मत मानिए, लेकिन हमारे पेरेंट्स के व्हाट्सएप ग्रुप में इस वैक्सीन के बारे में बहुत सारी बातें होती है। कोई कहता है इससे बच्चे के फर्टिलिटी पे भी इफेक्ट होता है, और एक आध पेरेंट ने तो ऐसा लिखा है कि ये वैक्सीन देने के बाद उसके बच्चे को पीसीओडी हो गया। तो ये कहाँ तक सच है, कितना
नहीं
सेफ
नहीं,
है?
ये कंप्लीटली मिथ है। और ये वैक्सीन ऑलमोस्ट 100 कंट्रीज में काफी सारे बच्चों में दिया गया है, एंड इट इज प्रोवन सेफ। उसके काफी स्टडीज भी है कि ये सेफ है। इसका फर्टिलिटी पे कोई भी नेगेटिव इफेक्ट नहीं होता है। इनफैक्ट सर्वाइकल कैंसर या वल्वा और वजाइना, यानी बाहर के जो फीमेल ट्रैक्ट के एरियाज है, वहां का कैंसर होने की वजह से फर्टिलिटी पे नेगेटिव असर हो सकता है। और ये वैक्सीन इनफैक्ट वो वाले कैंसर्स को प्रिवेंट कर रहा है। तो ये फर्टिलिटी में बिल्कुल भी इंटरफियर नहीं करेगा। आप बिल्कुल भी उसकी चिंता नहीं करिए।
ओके। तो मैडम सॉरी, लेकिन इसका कॉस्ट कितना है? क्योंकि अगर ये वैक्सीन इतना अच्छा है तो मैं मेरे फ्रेंड सर्कल, मेरे ब्रदर के भी बच्चों को मैं दिलाना चाहूंगा। इसका
हम
कॉस्ट क्या है?
हमारे पास 2 टाइप के वैक्सीन अभी अवेलेबल है। एक 4 सब टाइप वाला वैक्सीन है, उसका कॉस्ट है अबाउट 2000। वो भी इंडिया मेड है, इक्वली गुड, इट्स वेरी गुड। और एक 9 सब टाइप वाला वैक्सीन अवेलेबल है, जो उसका कॉस्ट ज्यादा है, जो लगभग 10,500-11,000 के रेंज में है पर डोज।
अच्छा मैडम, तो अभी आपने जो बोला ना 4 टाइप्स और 9 टाइप्स, तो मेरे फ्रेंड के बच्चे ने 4 टाइप्स वाला लिया था। तो अभी क्या उसे 9 टाइप वाला लेना चाहिए, या वो 4 टाइप वाला है वही प्रोटेक्शन देगा?
4 टाइप वाला वैक्सीन कॉमनेस्ट सर्वाइकल कैंसर करने वाले वायरस के जो सब टाइप है उनको कवर करता है, और जो स्किन के वायरल वॉर्ड्स बनाते हैं वो वायरस के सब टाइप को भी कवर करता है। और जो 9 वैलेंट है, वो बचे हुए एडिशनल 15% जो वायरसेस है, मेन 84% इसमें कवर हो जाता है। एडिशनल 15% कवर करने के लिए 9 वैलेंट वैक्सीन काम आता है। तो अगर अफोर्डेबिलिटी का इशू नहीं है, तो मैं रिकमेंड करूंगी कि आप जरूर वो 9 वैलेंट वैक्सीन भी ले लीजिए। पर एटलीस्ट कम से कम आप 4 वैलेंट वैक्सीन लेंगे तो भी काफी प्रोटेक्शन हमको मिलेगा, क्योंकि हमारा एम है काफी लोगों में ये इंफॉर्मेशन स्प्रेड करना। तो आप डेफिनेटली आपके पेरेंट्स को, आपके कलीग्स को इन्फॉर्म करिए और उनके पीडियाट्रिशियन से बात करने कहिए।
ठीक है मैडम, मैं ये तो करूंगा, लेकिन मैं वैक्सीनेशन का अपॉइंटमेंट लेना चाहूंगा। मेरे बच्चे का वैक्सीनेशन है 10 साल का वैक्सीन, तो उसी वक्त, बिकॉज आपने कहा 9 to 14 ईयर्स तक हम लोग ले सकते हैं, तो क्या हम उस वक्त ले सकते हैं वैक्सीन?
हम उस वक्त डेफिनेटली ले सकते हैं, पर कभी कभी हम भूल जाते हैं, पोस्टपोन हो सकती है अपॉइंटमेंट्स। तो अभी तुरंत अगर आप ले लेंगे, फर्स्ट डोज कंप्लीट हो जाएगा, 6 मंथ्स के बाद दूसरा डोज कंप्लीट हो जाएगा, तो शायद हम 6 मंथ्स का डोज आपके 10 इयर्स के साथ क्लब कर सकते हैं, हम ऐसा कर सकते हैं। तो अर्लियर द बेटर, क्योंकि बाद में हम काफी बाकी के लाइफ की चीजों में भूल जाते हैं।
ठीक है मैडम, ये जानकारी आपने दिया बहुत अच्छा किया, बिकॉज हमारे फैमिली में ये सर्वाइकल कैंसर का केस हो चुका है, मुझे आइडिया है, लेकिन मेरे दिमाग में बहुत सारे मिथ थे जो आपने क्लियर किए। और मैं डेफिनेटली मेरे बच्चे को वैक्सीन दिलाऊंगा, लेकिन मैं ये इंफॉर्मेशन में बाकी के पेरेंट्स, मेरे फ्रेंड सर्कल में डेफिनेटली स्प्रेड करूंगा। थैंक यू।
थैंक यू सो मच सर। आई सी यू इन
थैंक
द
यू, दैट
क्लिनिक।
वाज एक्सीलेंट। आई थिंक मिथ्स
Excellent.
नहीं, हमारा पूरा सबका रिवीजन भी अच्छा हो गया। डॉक्टर अनुजा, वेरी नाइस। डॉक्टर
Great.
राजेश कासला,
थैंक यू
you
मैम।
covered all the things very well. So I've also shared on the group the post test survey and the purple book experts, the 18 pages regarding HPV vaccine, which has all the information and all the queries that will come up regarding this vaccination. So I think with that,
Question about Gardasil 9.
uh,
After taking Gardasil 4, can they take Gardasil 9? So the thing is, you should always avoid interchanging of the
yes.
vaccines. However, if the patient comes to know about it and wants to, take that extra protection, for that extra protection, they would have to complete the entire schedule as per the age of the child. So if the child is less than 14, then 2 doses of 9 nonavalent, and if the child is more than 14, then 3 doses will be required.
Sure.
Yeah.
So I think you can stop slide sharing, Dr. Amin.
This is the last one, which I think
Yes.
summarize.
You have the power to make sure that no girl grows up in your community to hear these dreaded words. You have cervical cancer. And I think nobody more than us can take the step forward of starting this right from tomorrow and become HPV vaccination champions. So thank you everybody for joining this module. And of course, thanks to our co-trainer, Dr. Amin Kaba. And madam, I think, is no longer there. No, madam is left. And thanks all of you for participating and having such a wonderful interaction today. Stay in the group again, as we said, because you will be getting updates. And also try to propagate this forward and try to go across and take other talks also and ensure that people, most of us, join this campaign of HPV vaccination. Thank you, everybody. Thank you so much.
Thank you.
Thank you, Nehal. Thank you, Amin.
Thank you.
Thank you. Bye.
Thank you, everyone.